Hello, my name is Antoinette Doherty. I'm an advanced nurse practitioner. I work in respiratory integrated care here at the Chronic Disease Management Hub in Letterkenny. The brief of respiratory integrated care is to screen patients who have a suspected respiratory disease, and also to manage people with a known respiratory disease such as asthma and COPD. So if I take the patient with the suspected diagnosis, we have to assess those patients and do further investigations to confirm the diagnosis. The mainstay of our investigations includes spirometry testing. A spirometer can inform us of the flow and the measurements within the lung volumes, and from those numbers we can stage the level of disease and confirm a diagnosis of COPD. And if we've used reversibility, we can confirm a diagnosis of asthma. Individuals newly diagnosed with COPD will have further assessments. We'll be measuring their symptom burden, we'll be measuring their level of fitness. This may include a 6-minute walk test, which is measuring their breathlessness score and their oxygen level as they walk a distance, and we measure the distance they've walked in the time frame of 6 minutes. Once we've concluded our assessment, we formulate an action plan. Our action plan will include a review of medication and optimisation of medication, and there we're going into the territory of inhalers. There's a plethora of inhalers available to these patients. Sometimes the patients have been prescribed inhalers that are difficult to use and appropriate for their level of disease. So that's a case of reviewing their current medication, assessing the patient and how they take their inhaler, and seeing if we have something in the same category or a different category if indicated, and start that patient on the new inhaler. So there's a big part of the job is getting the right medication for the right patient with the right level of disease at the right time.
My name is Pauline McFadden. I'm a clinical nurse specialist in respiratory integrated care, and I work alongside Tara Cooper, senior physiotherapist. We deliver an 8-week pulmonary rehab programme in the community setting. This programme aims to improve patients' functional exercise capacity and quality of life by providing education, advice and support to help self-manage their chronic condition.
Well, the first thing I want to do is express my gratitude, the fact that the service is actually there for us. The access to the nurses, they're unreal people. And I would honestly say without them I wouldn't have the life I have today. I really appreciate that.